While we may not be hearing about it so much in the headlines these days, HIV is still a major global public health challenge. We have over 39 million people living with HIV today and 1.3 million new infections just last year in 2022. There are still about a quarter of people living with HIV who know their status are not accessing treatment, and even more of the people who are living with HIV don't yet know their status. Perhaps more devastatingly, there are others who are at increased risk of HIV infection who are not able to access the information and tools they need to protect themselves. We know from decades of experience that effective HIV programs rely on strong systems and governments that have the political will and commitment to invest in those strong foundations of a successful HIV response. At MSH, that's what we've been doing for the last 3 decades, working with partners to strengthen those foundations of the health system and of the community systems that they partner with, to reach those who are being left behind, and to put in place sustainable systems and structures to support an effective HIV control program. Financial sustainability is a critical aspect that we're tackling head on with our partners. One critical pathway that we see to ensuring sustainable financing for HIV services is through universal health coverage programs. By including HIV into national benefits programs, governments are able to ensure that in a sustainable way, the government will be planning for and allocating funding for HIV services into the future. In Cameroon, we've been privileged to partner with USAID to support the government in setting up and launching their national UHC program. Through catalytic support over the last 4 years, we've helped them to design and set up the fundamental systems that underpin an effective UHC program. My colleague Edith will speak more to this critical work and for the exciting roadmap ahead for the government of Cameroon.
The government of Cameroon is committed to providing universal health coverage to all the population and ensuring long-term health care for people living with HIV. This can be done by carefully planning for long-term financing for the human resources, the drugs, testing kits, and all the lab commodities needed. MSH provides technical and financial support to the Ministry of Health in developing an accreditation framework to guide health facility participating in the VSA program. In addition, we provide critical communication support to sensitize the public about the overall VSA program and especially the HIV services available through it. In April of 2023, Cameroon achieved a huge milestone by launching the phase 1 of the VSA program. MSH was part of this great achievement. Since then, over 1 million people have enrolled in the VSA program, including 140,000 people living with HIV. This is a clear testament of the government's strong commitment to ensure equitable access to essential healthcare services for every Cameroonian.
When we look at what MSH is doing in Cameroon, we look at the work that we're doing there, getting the government to endorse HIV services as part of universal health coverage is a fine example of what we want to see in a strengthened health system. Typically, we see that governments are funding and or responding to single diseases. And after a while, what we start to see is silos, and we start to see a disconnect between way services are provided for one particular program or for one particular disease versus another. But what we want to see is integration. We want to see interconnectedness. We want to see systems that work for all. We just launched our new 7-year strategy. We have several pillars. We have a focus pillar that looks at health system strengthening as a bedrock of what MSH does. We stand shoulder to shoulder with governments and local actors to make sure that systems are built country-led, to make sure that systems are sustainable, country-led. We want to see the government take ownership. We want to see the government finance its own plans. We want to see the government build lasting, sustainable solutions for its own citizens. And so when Cameroon decides to include HIV services into its universal healthcare coverage, that's the step we want to see, where we move away from silos to integration. So I think in all of that, I have to say I'm just super excited to be on this journey right now, right this minute. There's so much to do. There's so much to accomplish. We've done a lot, and I'm hopeful that the future is really bright and that we're going to get there.